Hey there! Have you ever been watching a medical drama on TV or even listening to your own doctor and felt like you needed a secret decoder ring just to keep up? Well, today, we're basically going to give you one. So you ready? Let's dive in and crack this medical code together. Okay, so imagine you glance over and see this written on a patient's chart. Stat FBC ABG UNE. I mean, it looks like complete gibberish, right? Just a random string of letters that means, well, absolutely nothing to most of us. If that looked like some kind of alien language to you, don't worry, you are definitely not alone. It's a language that's built for precision, not really for being easy to read at first glance. But what if I told you there's a simple logic behind it all, a system that you can actually learn in just a few minutes? That's right, this isn't just a random collection of words. It's a logical system, almost like it's made of Legos. And in this explainer, we're going to show you exactly how to break it down. By the end of this, you'll have the keys to start decoding it all by yourself. So, where do we even begin? Well, it all comes down to three core building blocks. You'll find that pretty much every complex medical term is constructed from these three simple parts. Once you get these, you get the entire system. So here they are, our three keys to the code. First, you've got prefixes. Those go at the beginning. Then you have the root words, which are really the heart of the term. And finally, suffixes, which, you guessed it, come at the end. Let's see how they actually work. Let's start with the parts that kind of bookend our terms, prefixes and suffixes. These are super powerful modifiers that can totally change the meaning of a word with just a couple of letters. A prefix is exactly what it sounds like. It's fixed to the pre or beginning of a word. Its whole job is to give us more information. We're talking quantity, position, maybe a condition, things like that. And right here, you can see the incredible power of just a few letters. Take hyper and hypo. Hyper means above or excess, like in hypertension, that's high blood pressure. But change just one little letter to hypo, and now it means low or deficient, like in hypoglycemia, low blood sugar. We're talking two completely opposite conditions, all defined by that tiny little prefix. Now for the other bookend, the suffix. This is the piece at the very end of the word, and it often tells us what's happening. You know, is it a condition, a disease, or maybe a procedure? For example, let's look at these two suffixes. An appendectomy, which ends in ectomy, means the surgical removal of the appendix. But a craniotomy ending in tomy means cutting into the skull. That ending completely changes the entire action. Yeah, it matters. A lot. Okay, so we've covered the beginning and the end. Now let's get to the foundation of the word, the absolute central piece of the puzzle, the root. The root word is basically the main character of our medical story. It usually refers to a body part, an organ, or a system. Just think of it as the what or the where in our medical sentence. Here are just a few of the most common root words you're going to see. Gastro/o refers to the stomach. Hepato is all about the liver, and entero relates to the intestines. Honestly, once you start recognizing these, you'll start seeing them everywhere. And here, this is where it all clicks together. We take our prefix hyper, meaning above or excess. We add the root word gaster for stomach. And we finish it off with the suffix algia, which means pain. Put it all together, hypergastralgia, excessive stomach pain. See, you just read a really complex medical term just by putting the blocks together. All right, you've learned the system. You've got the keys. Now it's time to circle back to that confusing patient plan from the beginning and see if we can solve it together. Let's do this. Remember this? The patient's diagnosis, or DX, is diabetes mellitus, and here are the pre-op orders. The rest of it looked like total alphabet soup before, but now we have a way in. Let's start with that first term right there, pre-op. Now, based on what we just learned about prefixes, what do you think pre might mean? Exactly. The prefix pre means before, and op is just common shorthand for operation. So pre-op orders are simply the instructions for before the operation. See? Simple, right? You just decoded your first piece of a real patient plan. Okay, fantastic job on that one. Now, besides word parts, medical language also uses a ton of shorthand. It's a different kind of code, abbreviations. For instance, the plan says NBM at midnight. Any guesses what that could possibly mean? NBM stands for nil by mouth, which is kind of a fancy Latin-derived way of saying nothing by mouth.
It's a super critical instruction that means the patient can't eat or drink anything. And now you know what it means too.
And just like that, you did it. What seemed like this intimidating, impossible to read jargon just a few minutes ago is now something you can actually start to understand. It really is all about knowing the system.
Of course, this is just the beginning of your journey. So how can you keep building on this? Well, here are 3 really great tips to keep your new decoding skills sharp. First, make some flashcards. I know it sounds old school, but the simple act of writing a term on one side and its meaning on the other is a really powerful way to learn. Second, grab a medical dictionary or use one online to look up new words. And third, make it fun. There are tons of terminology games and quizzes you can find to practice.
You now have the fundamental tools to break down the language of medicine. The code is no longer a secret. So I guess the only question left is, what medical mystery are you going to go out and decode next?